Neonatal Resuscitation. This film will show you how to resuscitate a newborn baby. It is based on the Resuscitation Council UK's guidelines and will focus on the following essential manoeuvres: keeping the baby warm, assessing the baby, opening the airway, breathing, and chest compressions. Once learnt, these skills will allow you to help save the lives of newborn babies. So why do some babies need resuscitation? If a fetus experiences a significant lack of oxygen before or during delivery, its breathing movements become deeper and more rapid. The heart rate at this point remains normal, but if oxygen levels continue to fall, all breathing movements stop. This is called primary apnea, and at this point the heart rate will also fall. If the oxygen levels fall further, the fetus begins to make deep, slow, gasping movements. When the gasping stops, the fetus then enters terminal apnea. The heart rate will continue to drop, and if not delivered soon, the fetus will eventually die. If the fetus is delivered during primary or terminal apnea, the person attending the birth will need to help the baby breathe and in some cases establish a normal heart rate. This is called neonatal resuscitation. Preparation. The need for resuscitation is often unexpected. Therefore, the person attending the birth should be trained in neonatal resuscitation and well prepared at every delivery. Firstly, it is important to find out if the mother has experienced any conditions that may put the baby at greater risk of needing resuscitation. Is she expecting twins? Is the baby preterm or small? Ask the mother if she has had any infections during the pregnancy, if she has been in labour for over 10 hours, and if she has had any bleeding or evidence of meconium. Preparing the room is also essential. The room must be warm and free from drafts. This is to prevent the baby getting cold. If you have a radiant warmer, switch it on. Make sure there is a good light source to assess the baby. This could be daylight, an overhead light, or a bright torch. Prepare a flat, firm surface with warm, clean towels. Equipment. A clean bag and mask is essential. A stethoscope and reliable clock are also necessary, as you will need to time the delivery and duration of resuscitation. Lastly, wash hands and put on gloves. Resuscitation. We will start by showing a demonstration. Immediately after delivery, dry the baby, discard the wet towel, and wrap the baby in a dry, warm towel. Assess the baby's colour, tone, breathing, and heart rate. Begin resuscitation if necessary. Put the baby's head in the neutral position. Listen to the heart rate, which should increase, and look to see if the baby's chest is moving. If not, give 5 inflation breaths. Look to see if the baby's chest moves. 1, 2, 3, 2, 2, 3, 3, 2, 3, 4, 2, 3, 5, 2, 3. Reassess the baby's heart rate and consider whether the baby's chest moved with inflation breaths. If there's no improvement, do a single person jaw thrust and give 5 inflation breaths. Look to see if the chest moves. 1, 2, 3, 2, 2, 3, 3, 2, 3, 4, 2, 3, 5, 2, 3. Reassess the baby's heart rate and consider whether the baby's chest moved with inflation breaths. You may also do a 2-person jaw thrust and give 5 inflation breaths. Look to see if the baby's chest moves. 1, 2, 3. 2, 2, 3. 3, 2, 3. 4, 2, 3. 5, 2, 3. Reassess the baby's heart rate and consider whether the baby's chest moved with inflation breaths. Once the chest is moving, the baby may still need help to establish regular breathing. Give ventilation breaths. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. If the chest is moving but the heart rate remains low, give chest compressions. One, 1, 2, 3, 2, 1, 2, 3, 3, 1, 2, 3, 4, 1, 2, 3, 5, 1, 2, 3, 6, 1, 2, 3, 7, 1, 2, 3, 8, 1, 2, 3, 9, 1, 2, 3, 10, 1, 2, 3, 11, 1, 2, 3, 12, 1, 2, 3, 13, 1, 2, 3, 14, 1, 2, 3, 15, 1, 2, 3. Reassess the baby. When the baby has established regular breathing and a normal heart rate, the baby can be given to mum. Please note that should a small or preterm baby require resuscitation, the process is exactly the same as that for term babies. We will now go through each stage of neonatal resuscitation. Keeping the baby warm. Babies are born wet and as a result can become cold very quickly. This can lead to complications including death. Therefore, it is essential to dry the baby, discard the wet towels, and then wrap the baby in clean, dry, warm towels. Small and preterm babies lose heat more rapidly than bigger term babies, so it is extremely important to keep them warm. Assessing the baby. When a baby is delivered, an assessment is made of the baby's colour, tone, breathing and heart rate. A healthy baby will have good colour, meaning pink lips and tongue, a good tone, meaning good movement of its arms and legs, will establish regular breathing within 30 seconds, and will have a heart rate above 100 beats per minute. This baby does not need resuscitation and can be given to mum. A baby in need of resuscitation will have blue or pale lips and tongue, will be floppy with very little tone, will not be breathing and will have a very slow heart rate of less than 100 beats per minute. Where possible, get any other adult available to help and begin resuscitation immediately. You may also need to call for further help. Opening the airway and breathing. The neutral position. To open the airway, the baby's head must be placed in the neutral position. The baby should be lying on a flat surface on its back. The neck must not be flexed or extended, meaning that the baby's face is positioned parallel to the surface. Maintain the neutral position by supporting the baby's head with your hands. Place the mask over the baby's mouth and nose. The mask must be the right size and form a good seal. It should not press on the baby's eyes or overhang the chin. Give 5 inflation breaths by slowly squeezing the bag. Each breath should be 2 to 3 seconds long, and you should see the baby's chest moving. Allow the bag to reinflate after each breath. 1, 2, 3. 2, 2, 3. 3, 2, 3. 4, 2, 3. 5, 2, 3. After the inflation breaths, reassess the baby. Listen to the heart rate, which should increase, and look to see if the baby has started to breathe. Once the baby's lungs have been inflated, the heart rate should increase to over 100 beats per minute, and the baby should establish regular breathing. In most cases, putting the baby's head in the neutral position and giving 5 inflation breaths is all that is needed to open the airway and inflate the lungs. The baby will establish regular breathing without further help. If the heart rate does not increase and the chest does not move with inflation breaths, then you have to open the airway using either a single person or 2-person jaw thrust and repeat the inflation breaths. Single person jaw thrust. Position your fingers over the angle of the baby's jaw, lift it forwards and hold it in place. Using the other hand, place the mask over the baby's mouth and nose and give 5 inflation breaths. Two-person jaw thrust. If another person is available, you may do a 2-person jaw thrust. One person supports the baby's jaw forwards with both hands and holds the mask in place. The second person gives 5 inflation breaths. 1, 2, 3. 2, 2, 3. 3, 2, 3. 4, 2, 3. 5, 2, 3. After either of these methods, reassess the baby. Listen to the heart rate, which should increase, and look to see if the baby's chest has moved with inflation breaths. The baby should then establish regular breathing. Ventilation breaths. Once the lungs have been inflated, the baby may still need help to establish regular breathing. In this case, ventilation breaths are given using the bag and mask. Give ventilation breaths at a rate of 30 per minute. Each breath should be 1 second long. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Reassess the baby every 15 ventilation breaths. Make sure the head remains in the neutral position, the heart rate remains above 100 beats per minute, and look to see if the baby is breathing. Continue to give ventilation breaths until the baby establishes regular breathing. Meconium. In most cases of meconium-stained liquor, the baby will not require resuscitation. However, if there is thick meconium present and the baby is not breathing, don't delay inflation breaths. Ideally, the airway should be inspected under direct vision and meconium suctioned. Chest compressions. Chest compressions should only be considered if the baby's heart rate remains below 60 beats per minute. The need for chest compressions is rare. Before starting, make sure the baby's chest is moving in response to inflation and ventilation breaths. There is no point in giving chest compressions if the baby's airway is not open and the lungs are not inflated. Encircle the baby's chest with both hands. The fingers should support the spine and back, while the thumbs are placed on the sternum just below an imaginary line joining the nipples. The thumbs then compress the chest by a third, quickly and firmly. 3 chest compressions are given to one breath. 1, 1, 2, 3. 2, 1, 2, 3. 3, 1, 2, 3. 4, 1, 2, 3. 5, 1, 2, 3. 6, 1, 2, 3. 7, 1, 2, 3. 8, 1, 2, 3. 9, 1, 2, 3. 10, 1, 2, 3. 11, 1, 2, 3. 12, 1, 2, 3. 13, 1, 2, 3. 14, 1, 2, 3. 15, 1, 2, 3. Chest compressions are continued until the baby's heart rate has increased. Usually the heart rate responds quickly. Check for a response every 30 seconds and that the chest is inflating with each breath. When to stop resuscitation. This is always a difficult decision and, if possible, should be made by an experienced clinician. If the heart rate is not detectable after 10 minutes of full resuscitation, then it is appropriate to consider stopping, as the outcome is extremely poor and the baby is unlikely to survive. To summarise, be aware that assessing the baby happens immediately after delivery and resuscitation begins straight away if needed. The longer the baby is without oxygen, the greater the risk of brain damage, so decisions and actions must be taken rapidly. The first minute of life is crucial. Keep the baby warm by wrapping it in dry, warm towels. Assess the baby's colour, tone, breathing and heart rate. Open the airway by putting the baby's head in the neutral position and give 5 inflation breaths using the bag and mask. If this does not work, use either a single person or 2-person jaw thrust to open the airway and then give 5 inflation breaths. You may also need to give ventilation breaths. In rare cases, chest compressions are necessary. Reassess the baby after each intervention, listening to the heart rate and looking to see if the chest is moving. Remember, unless the airway is open and the lungs are inflated, there is no point in giving chest compressions. Therefore, it is essential in neonatal resuscitation to open the airway and ensure that the lungs are inflated. In the vast majority of cases, this is all that will be needed.